Good morning. Today we will talk about autism. Autism is a special character or a special child. We have to know everything about him. In this lecture, I start to tell you our registered workshops now. Now, we have before a live Zoom session for our workshops. Now we have a registered, or you can go registered workshops. You can go and hear them a lot of several times. Our workshops, it will be in Arabic and in English, this version in English. And you can go to the vizona.com, www.vizona.com, or Body Mechanics. This is a center in Florida with my magic colleague, Dr. Anna. Okay, so I'll start by how I tell you what is the workshop. I split the workshop into 8 parts. Each part is 15 minutes. The first part I publish on YouTube, that what you are seeing, what you see now. Then the rest of them, you can book them and to go to you can go this number. This is a WhatsApp number. You can text or call to book this workshop. Or even you can go to the email, or and even you can go to the website www.vizona.com. First of all, I start to tell you. First of all, I want to tell you about the exact website. Hold a moment, please. Because I want to write the website for you now. This is Vizona. Yes, this is the website. Excuse me. We can go like this, and I write it here. Okay, whatever. Yes. Okay. I in the next page. You can write in the next page here. Okay. This is the website. www.Vizona. Okay. Vizona.com. Yes, this is a website of Body Mechanics, and Body Mechanics. This is a center in Florida in United States. You can go there and you can book even your you can book for our lectures. Okay. Now let's start by our lecture now. Hold on. Okay. Yes. As you see here, I split it into 8 parts. First part about the definition, second about the causes and pathophysiology, third about the clinical picture, the symptoms, fourth part about the diagnosis, how can I diagnose the autistic child in my point of view as a physical therapist, what is the problems, how can I define the problems, what the degrees of these problems, and then I define the treatment strategies for this case. After that, at the end of the workshop, in the last hour, this is the workshop lasts for about 2 hours, maybe it is more 2 hours. The first 15 minutes about the first 5 exercises. Each 15 minutes we have 5 exercises to be doing exercise at the end of this workshop. I'll explain it exactly what will happen to be a practical workshop and know how to benefit the child, how to offer a treatment for some problem of the autistic child. Okay, let's go. First of all, we have this is a website, Vizona.com. You can find my English version of my workshop over there. This is a biomechanics center for my special colleague, Dr. Ayana. Okay. Okay. Well, let's start. What is autism? We have to know what is autism. Autism is a spectrum. It's a spectrum. It means that it is a big umbrella, has a lot of behaviors, and we have to know that behaviors is a symptoms. It is not a cause. Okay, so when we want to treat the behavior, the symptoms, or mediate the symptoms, we have to go to the cause, to be a causal treatment, not a symptomatic treatment. Okay. First of all, autism resulting from a neurological problem. So we have a problem with the brain and the central nervous system. We have a lot of theory. I have talked with these theories when we are talking about the etiology and pathophysiology. But now I want to start by this because this is the most theory I like it to deal with autism. To deal with autism, I deal with him as we have, this child has a minimal brain damage, but diffuse. Yes, if you look to the autistic child, you see him, he is good in everything. He is supposed to be physically normal, but not normal. Not at all normal. He has some problem in his movement. It's not a normal movement, but he can walk, can sit. If he has a pure autism, if he has co-care with other illnesses like cerebral palsy or something like that, that is something else, because that it can co-care. We have two problems. Second, so we have in language, he can talk, but he understands you. He doesn't have any problem with his articulators, but he doesn't talk. So for this reason, we said that we have minimal brain damage. It doesn't affect the communication, but it diffuses on all the brain concerned with all development, whatever it is, motor development, it is social development, psychological development, cognitive development, etc. Okay. So we have a developmental disorder. The first is that is autism caused by a neurological problem and the developmental disorder. What happened? Developmental disorder. This insult happened at the start of the life when I have to start to mature linguistically or communicatively and socially and motor. All of maturational areas start from after I have after birth. This problem happened at the start, so all of the developmental areas has a disorder. This disorder, you can say this, we have a delayed development or have a pervasive development. The child, maybe he can do something, or he developed in a pervasive way or an odd way. Also, we have to know what is autism. Auto, it means that the child, he doesn't need, he want to be with himself. He doesn't want to interact with others. That is auto. And ism is related to the symptoms. We can say that like ism is like a symptoms. We can say that blindness, like it connected to the eye, auditoryismus, smellismus, tactilismus, something like that. So that is why we said it autism, okay? This problem starts since birth. But like what you see now, this problem can be cleared at, or it will be cleared at 2 years old. Because suppose at 2 years old, I can walk, I can talk, I can have some cognitive abilities, so I developed. So after 2 years, the pervasive development of the development disorders will be very clear, because at this time the child is supposed to be developed. But we have to do early screening. Early screening, we have to do the early signs of autism, because if we know these early signs, we can offer an early intervention, which is important. So we have to know the early signs of autism and early screening for early intervention. This problem considered as a psychological, not a psychological problem. Why autism is a psychological problem? Because it's a behavior. We don't have an organic cause. Now, we have a theory about the cause and the pathophysiology, but we don't have an exact cause. Because, for example, or for instance, if I want to know that is autism, I can't do like MRI to know he is autistic or not, or we can't know blood analysis, whatever. We don't have a specific damage or a specific organic cause for autism. Autism is known by behaviors. Some behaviors. I said a lot of behaviors: social behavior, communicative behavior, routine, good memory, repetitive behaviors. All of these. This is the autistic child. The symptoms. From these symptoms and these behaviors, we know we can define the autism. Okay. So I have to move to do what is behaviors. Behaviors, I said before, behaviors is that symptoms and not a cause. Okay, behaviors is, we know that our brain has a pathway to get in, then here to understanding and processing, and we have another pathway to get out. Okay, so the behavior is the output of the brain. The output of the brain is the behavior, and most of all, it's motor. When I am talking, this is a behavior, and I'll show you a simple behavior. This is a behavior of an anxiety. If we have here, this is a simple behavior. It's called withdrawal reflex. If I touch this hot pan with my hand, it's hot, so I feel hotness. After I feel it, it will be this sensation carried to the spinal cord and then to the brain, and the brain now understand and process, and suddenly you will withdraw. So this is a withdrawal reflex. When I saw this is withdrawal is the behavior, so I have to go to the cause. Why the child withdraw a hand? When I withdraw a hand, when I avoid touching, when I avoid looking at someone, when I avoid hearing. So maybe I have, sure, you have a cause, and this cause, most of it will be sensory cause, and we will talk about it again. Okay. Now, also, we have to go to the brain. We have to know that we have this, a brain is present inside our cranium or skull, and he communicates, or the brain communicates with the outside environment through the senses. We said we have input and output, and this is the brain. We have a cranial input. We have 12 nerves which go to the brain and come from the brain directly, and the rest of the nerves coming from the spinal cord. Okay, and the spinal cord like a pathway, so it can be these nerves can go directly to the brain, or can go the spinal nerves to the spinal cord, and the spinal cord carrying this information to the brain. So this is the two other or two ways to carry the information to the brain. If we see here the 12 cranial nerves, we see the olfactory nerve, the first nerve, and it's very important nerve. It affects from me emotionally because it is connected to the amygdala and septic nucleus. We can go to the optic nerve, the second cranial nerve for the vision, and we have to go to the nerve by nerve, like vestibulocochlear. We have vestibulocochlear, we have oculomotor, abducent. All of these nerves, cranial nerves, carry the information to the brain and take it. After the information is coming in, understanding, processing, and then the brain decide and get an output of this information in a form of behaviors. Okay. So we have to know what is the gates of our brain, what is the senses of our brain. The brain has information from 10 gates, 10 senses. First, we have the vision is a sense, we call it far receptors. So I can see from a far distance. This is the biggest sense. A special sense can have a lot of information from away. But this is an auditory, what I can hear from a far distance. And this is a smell, it's still a far receptors, but somewhat far receptors and very special because it affects me a lot, especially emotionally. And we have to say that about, or have to understand that about the autistic children, okay? Then the test, the receptors, I have that something should touch my tongue to test it, tactile receptors, And also we have just 5. We have a sense of movement by 2 receptors. The receptors inside the joint and muscles, which is at skin. This is a proprioceptive. Also, we have a vestibular system. Vestibular system, it is also at the receptor of movement. Now we have 7 senses. Also a hand. The hand considered as a sense. Hand, it is not, it is, I don't have 4 limbs. Hand is a special organ. Hand is the second important organ of our body after the brain. By hand, it can grab and have a special touch, so I can see by my hand. And we have a special statement say that hand teaches vision, okay? Now we have going to the, we have now 8 senses. We have the 9th sense is the interoceptive. I can feel my colic, pain, I can feel my breath, I can feel my heart, something like that. This is what we call interoceptive. All of these are gates for the brain to take an information over there. When any information comes to our brain, the brain should be react by behavior, okay? The last one, the imagination. Now I can, in my thinking, I can imagine something, I can talk to myself, and I can imagine something. So also this is information of our brain. Lastly, I want to talk about the brain like we have to imagine it like an iceberg. The small top of the mountain, our brain, our bird, is the conscious brain. And a lot of it under the water, this is unconscious brain. Unconscious brain can see, can understand, can react without my consciousness. So this is very important thing. That's why we can react and communicate with unconscious brain that is works most of our hours, okay? Okay, now I'm talking about something here also because I want to understand how the behaviors come. We are looking here, I am looking about the 3 senses, was about the tactile and the auditory and about the vision. I talk about these 3 senses. We will find the tactile here in parietal lobe, and in temporal lobe we can find the auditory and the vision in occipital lobe. Here, these 3 parts. But we can make like a relationship, or we say that conversion, neurological convergence, or multisensory convergence. That means we have in between the auditory and the temporal and the occipital lobe here auditory, and here is vision. We have in between here, we call it, we have here an area for both of these senses to integrate. And also between vision and tactile, we have a sensory area for integration, like what we see here. Here, this area is for integration. Also, we have an area here underneath the auditory part. This is to communicate. This is an area for integration between tactile and auditory. Say here, auditory, and underneath we have an area between tactile and auditory. Here, auditory, and here vision. We have here an area between tactile and vision, and also we have here also an area for integration. Between all of these senses, we will find here, this is MS, this is multi-sensory convergence, where all of these 3 senses interact with each other, very important senses. This area is the basal ganglia, where the thalamus and the putamen and the globus pallidus, all of these basal ganglia nucleuses present over there. So these senses will be integrated over there. So the senses integrated means that it go inside, then the brain analyze it, understand it, and then understand it, analyze it, and then processing, and then the output is the behavior. Okay, here I want to show you an autistic child. See, I don't like label. I don't like label, and don't say that this is an autistic child. Don't label, please. But all of us, we have autistic behaviors. So that's why it's very important. So look to this child. This child, about, you see his hand, is about to physically normal. He refused to stand. She refused to stand. She refused because she has a cause. We have to search about it. She has a perfect hand usage, but she likes to play with tools. Look to his vision. We lack the eye contact. Eye contact is very important for communication. You can take a lot of communication from my eyes, like I will talk with you about these things more. Okay. Another child here. So this child, he can walk and he smile, and suddenly he's crying without specific cause. She has a cause, but we don't know. So we have to searching about that cause. And this is, we will understand it in the pathophysiology and the theories and the causes of the autism. Why? Because we have to analyze all of these behaviors, and we have to know the causes to go directly to these causes and solve these problems. Now I want to talk about two things generally, because when I define autism, when I am talking about the symptoms and the clinical picture, we have to understand what is the social stimulus. Social stimulus is just a stimulus, like any stimulus, but different than the other stimulus. I said that the senses will be affected, that our 10 senses, our 10 gates of the imprisoned brain, affected by the stimulus. The stimulus comes from the outside environment. Anything comes from outside environment, we call it socially. We call it socially. So this is a social stimulus. We have four types of social stimulus. The first type thing is around us. Yes, this is the cup, is a social stimulus, but it is a thing. So maybe I have a bird. A bird is a social stimulus. Maybe I have an animal, is a social stimulus. A human is a social stimulus. So now the social stimulus developed from a thing to a bird to an animal to a human being. The human being is the biggest and most complicated social stimulus. And now we have to differentiate between them. What is the characteristics? What is the difference between things and human? First of all, the human is multiple. If you go to this cup, this is a glass, this is coffee inside, nothing more, right? And this is transparent, maybe we have a little of information here. But look at me and compare this social stimulus as a high social stimulus. First of all, you have to know who I am, my sex, if I am a girl or a female or male. What about my age? What about my position? What about my religion? What about my nationality? A lot of things you coming out for me, okay? Second, you have to look to my hair. What is the appearance? What's my facial expression? Or what is, sorry, my face, my faces, what I am wearing. All of these, this is information coming at you. So it is multiple, but this one is simple. Second, for this information, so the multiple of this information, it will be many, also it be different. I can give you a tactile stimulation if I touch you. Yes, but you have to touch this one to feel it. But me, as a stimulus, I can't touch you. Also, I can give you, like now, I'm giving you a verbal information, a verbal stimulation or acoustic stimulation. I am very different, and this is simple and little, okay? I'm complicated. If we are talking about the integration, because I am a lot of information and I am a different information, and this is simple. So you have a lot of sensory integration. You have to relate all of this information coming to you, integrate it to understand who I am. Because when I don't see this cup, but I have understanding what this cup. I had understanding what's cup, but by its physical character. If I touch it by my hand, this is the sense I said. Yes, it's a cup. See, it's a glass. It's a glass. Now, if I taste it, it's a glass. If I taste the coffee, I know the coffee inside it. So here I can understand things by the integration. For me, I have a lot of information coming at the same time to you, and it's complicated. Okay. So first, we have to say that the social stimulus as a human is multiple, many and different, complicated, multiple integration. I am a sudden to you. This one doesn't react to you. If you go to it, it will be react to you. But me, I can come to you suddenly, and I can talk to you suddenly. I can react to you suddenly. Okay? So you have, when I stimulate you suddenly, you have to react suddenly to me. So this is, I'm complicated. I'm not easy. Also, I'm successive. Like now, like what we are doing this conversation. If I'm talking, you do and talk to me back, and I give you another stimulus and give you a behavior, your behavior or reaction, it will be a stimulus for me, and it will be a successive. So social stimulus, human social stimulus is not easy. It is too much complicated and hard. For me, I'm unpredictable. You can't predict me. If I said for me good morning, it doesn't mean that I said for you good morning. But you predict something like you are playing with me like a ping pong. But for this cup, if you put it here, it will be stay here. If you knock it, will you have you could hear a sound. So you predict this. For me, I'm unpredictable. So see how social stimulus is for human is a lot of complicated. It is multiple, different, complicated, multiple integrated, sudden, successive, unpredictable. So what the autistic child do with these, all of these? Not autistic child, even what you are doing with the social stimulus. Most of us withdraw from the social stimulus. Only if you have a good social skills, you can confront this social stimulus. But if you don't have what you are doing, you do social withdrawal to avoid this stimulus because it is a big and you don't know how to do it. I give you an example. When you are young, when I am about in adolescent stage, about 11 or 12 years, when I bought my eyes on a girl, just because this is a big social stimulus for me, I'm doing like that because I block the stimulus because it's a big, I don't know how to react. But now, because I have a more skilled social skills, so I can look to the girl's eyes or the female eyes, and I am not sensitive to that. I'm not blocking. Communication. Second, we have to talk about the communication. Communication, especially communication, easy communication is transforming information from one to other. That is communication. To transfer information from other, that is the communication. If I can transfer my information to you, so I can communicate to you and I am understanding you, so that is the communication. Speech, it is not a communication. It is the highest degree or the mountain or the of our pyramid of communication, but it is not communication. We have two types of communication. We have non-verbal communication and verbal communication. Verbal communication by sound, non-verbal communication without sound. What is the non-verbal communication? Non-verbal communication, you can see here eye contact. When my eyes has a lot of information. That's why when I'm talking with you, you have to put your eyes on my eyes to read and understand what my eyes tells you. What my eyes tell you. Also gas shift. If I'm looking at you and I turn my eye from person to person, so that is also a message. So this is a way of communication. Facial expression. All my faces express to you or giving you information about my emotional status, and a lot of information for me coming at you by facial expression. Also body gestures. So when I stay like that, if I'm staying like that, if I'm sit like that, if I'm staying like that, so this is all information coming to you from my body gesture. So also I can gesture by my thumb about something. I can point to my hair, I point to my eyes, I point to you. So also this is non-verbal communication. Also, you have to know that the communication distance, when I am talking with you, if I am talking with the person, the distance between me and him, it will be from 15 centimeters to about 120 centimeters. When this person, he is so related to me, and I want to be affect him, and we have an emotional relationship. So I, like my daughter, my wife, something like that, I saw my distance could be 50 centimeters. If we are, the distance increase, so we are emotionally separated, and I give you a message that is, you are not, I have a distance between me and you, and the distance will be increased to 120 meters. If I'm talking to the person with 120 meters, so we have, this is a message for him. When I am coming near to him, so this is other message. So this is a way of communications. If I am talking to the group, I have to take a distance about 4 meters if I want to talk with him. Okay, all of these as a way of social communication. Also a touch. If I touch you, if I catch your hand, if I put my hand in your shoulder, in your hair, so this is a way of communication, non-verbal communication. My appearance, if I'm making my hairstyle, if I'm making my clothes style, so this is a way of communication, a message to you to communicate with you. Also, if like for social media, I use a special logo for me. So this is also a way of communication. If I now like I wear my top and I tie because this is an information for you, or this is a way of communication for you. That means you are formal. So this is ways of non-verbal communication. We have to go to the verbal communication. Now I start to use my sound. I said that like you before, my sound is the highest way of communication. And I started sense verbs. Sense verbs. First word, I use it when I just come out from the uterus, I cry. When I'm crying, this is a sound. And before I want to say that, what is verbal communication? It is the sound affects others. When you are affected by my sound, that means that that is a communication. So now I am talking with you. I said for you, come. Come is a sound. And now you understand it. Maybe you come, maybe you said no, maybe you ignore me. All of these are behaviors or reactions to come. So I affect you. But if I said you in Arabic, ta'ala, you don't understand what I said. So this sound doesn't affect you. So verbal communication is the sound affects others. I start this game first. And also we said that the sound, it should be an cause and effect. Okay. Now I start by verbal development of speech. First of all, I'm crying. When I get out of the uterus of my mother, I start to cry. This is a message. I want something. I want to eat. I want to sleep. I want to change my diaper, whatever. When I want to do something, just I'm crying. So I'm going to the second step. I'm using the paralinguistic language. I start to make a tone, a different tone of my cry. And this tone reflecting that I'm hungry, I want to sleep, I have a colic pain. So each tone of crying will be different to give you another message. But now I start to use my sound. Also the loudness, amplitude of my sound. The amplitude of my sound, it reflects that I'm in special need. So maybe my crying is coming up and down, the amplitude, and even the tone. We know that the sound has a frequency and the amplitude. I use the frequency for different tones and the amplitude also for kind of communication. Then I start to vocalize. I start to use my articulators, the tongue, the lips, soft palate, okay? Because now when I'm talking, I breathe it out. This is expiration, or I breathe it out. And this by vocal cords, the sound coming like vocal cords may make like that. When I talk, this is the two vocal cords coming apart and near. I'm making a sound. And my articulators, I use my articulators, the tongue, the soft palate, the jaw, lips, and all of these will produce the sounds. I start to vocalize and train my my articulators. I start by vowels, a, I, u. And then I go to the consonant like papa, dada, nana. Then I start to say non-specific words. Don't forget, Baba, Mama, it is an international language. It is not Egyptian or American or Arabic or English language. It is international language. Even the child who is a deaf, who can't hear, he will say dad, Baba, and Mama. Okay, so this is an international language. But he said first this Baba and Mama non-specific. And because this is use the cause and effect process, I said for him, yes, I'm Baba. In Arabic here I said Ana Baba. You want me? In English, and said we do said it in different ways, but says it is Baba and Mama. And now we transfer the non-specific word of Baba and Mama to specific words. And now the child try to increase his words from 2 words to 3 to 5 and start to make the sentence composition. We make 2 words. What this? What this? Like that? Or oh no, like that. And after that, sentence composition from 2 words to 3 words to 5 words to big sentence. Also, I know the plural, how I make it from a glass to glasses. And the preposition reversal, like this is my and mine, this is my and this is yours. And by that way, the language develops. Second, thank you for hearing and listening to me. If you want this workshop to complete it, call or text us on this number. You can, this is a WhatsApp, and you can call us in this one. Also, we can email us in this email to book this workshop. Thank you for listening. I'm happy to be with you. Bye.